A lot of our planning focused on improving the care for men undergoing a transrectal ultrasound-guided prostate biopsy. A standard scheme of 10 cores are taken at the Ottawa Hospital, and we have 2 procedure rooms for trust biopsy that are right on our unit. Currently, trust biopsies are performed in the Cancer Assessment Clinic every Monday and Thursday, and we've been given 15 designated spots for our patients on a weekly basis from diagnostic imaging. And this graph just shows that for the past 3 fiscal years, we've maintained our wait time target from consult to biopsy of 14 days or less. And these wait times do exclude any patient reason for delay. So how did we do it? Well, with ongoing communication and collaboration with diagnostic imaging, and biopsy team meetings have become a routine and regular occurrence so that we can deal with any issues or concerns as they arise. We became accountable for watching the wait times and the patient flow and demand. We have the ability to request additional biopsy spots if necessary. And we have a very responsive system to wait times. Every patient leaves with a written plan of care, a follow-up appointment, and for the results. So overall, we've changed the patient experience. We really expected we'd have to double our resources and equipment, but we didn't. We got rid of the wait time, the queue, without any real increase in resources through the coordination of care. So I'll talk a bit about safety associated with prostate biopsies. And certainly risks associated with biopsy include infection, bleeding, and urinary retention. And one of our goals was we wanted to standardize the care amongst the urologists, not just within our unit, but across the region, particularly concerning the antibiotic protocol. And there was a concern at the time that patients were developing a resistance to an antibiotic called Cipro, which is given prior to biopsy. And this resistance was causing an increased risk of infection. So lead physicians in urology and infectious diseases, they did an extensive world review. And with input from pharmacy, urology, infectious diseases, new guidelines for antibiotic prophylaxis were developed. It was a team management approach. And the communication of these new guidelines and the education of physicians, nurses, clinic staff, ultrasound staff was all left to the Cancer Assessment Clinic. So this slide just shows you the new antibiotic protocol for patients undergoing a trust biopsy, as well as those for fiducial markers prior to their radiation treatment. And so Cipro and Septra are given. Now, if there's any patients that have an increased risk of infection or that have an allergy to sulfa, what we've developed is giving the patients an IM antibiotic. And this is given by the nursing staff right in the Cancer Assessment Clinic. So patients that may be at increased risk of infection include those that had a serious infection with a previous biopsy, who have a history of prostatitis. Those patients who've received that drug Cipro or any member of its family that they can become resistant to within the past year, and any patient that's had a transplant. As a sidebar, any patient that comes to our unit and hasn't possibly taken their correct antibiotics, we can simply get an order from the radiologist and give them an IM antibiotic. So therefore, we don't have to cancel their procedure. And certainly nurses in our unit play a major role in responding to any patient emergencies during their biopsy, and we have had a few. The majority have been what's called a vasovagal response, where they have a drop in their blood pressure and sometimes require starting an IV to give them fluids. But we've also had patients with chest pain and patients who've had a cardiac arrest. Preparing a patient for a procedure with both factual and sensory information will certainly decrease their anxiety and increase their satisfaction. Nursing has optimized the preparation of our patients with consistent education. With input from the interprofessional team, nursing has developed pre- and post-biopsy instructions. So patients receive detailed information explaining the nature, the risks, possible side effects, and any other special instructions they need prior to their biopsy. It certainly has stressed the importance of going to emergency if after their biopsy they develop fever or chills, which could be the signs of an early infection, and certainly if not treated can sometimes turn into a very serious infection. Every patient leaves our unit with a plan of care, a follow-up appointment, and also a nurse contact number. So patients really value this, that they have a phone number where they can call a nurse, and if they have any questions or concerns, that someone is going to get back to them in a timely fashion. Trust biopsy procedural pain has been largely unrecognized and overlooked. And in a review of the literature, there's many psychosocial factors that affect the level of pain. Certainly the anticipated physical discomfort, the issues of individual mortality, cultural inappropriateness of the procedure itself, and the fact that it's just an uncomfortable and embarrassing procedure with the anal penetration. I know, I really sympathize. I do. Yeah. It's bringing back probably painful memories. Oh.
36.
Yeah. So I'm sure many of you recognize this from Richard Berkinson's wonderful book, Assume the Position, and also the wonderful illustration from Mark Girton. But certainly the patient's own self-report of pain is the single most reliable indicator of pain. And giving freezing for a prostate biopsy wasn't standardized amongst all the radiologists when we first opened, and many of our patients were coming back after their biopsy and they were complaining that it was very painful. We heard quite often comments such as this one: I was able to manage the pain during the first few biopsy bites, but by the time they got to the 5th and 6th, it was unbearable. A patient quality survey was initiated by nursing. We wanted to address the patient reports of pain, and it sort of gave us a snapshot in time. So this slide indicates those patients who experienced pain, those who had no anesthesia, those that had pain with anesthesia, and those patients that weren't certain whether they had received anesthesia or not. We also wanted to know the level of pain that these patients were experiencing. So these results clearly indicate that those patients who received freezing experienced lower levels of pain compared to those who did not get freezing. So the results of this survey and patient comments were discussed in a team meeting amongst radiology, urology, and nursing. And what happens, it changed the standard of care. So every single patient now at the Ottawa Hospital undergoing a biopsy now receives freezing for a trust biopsy. And the use of anesthesia for trust biopsy is also being written into our regional guidelines. And it certainly has decreased patient anxiety. As one patient stated, this was my 4th biopsy and I was very anxious about the pain. I received freezing this time and it was a breeze compared to the other times without it. And this just gives you a picture of one of our procedure rooms with 2 of the sonographers, Peggy and Mo, and they are wonderful. They certainly do their best to put patients at ease. We've really improved the patient experience through a team management approach, certainly in terms of reducing the wait time, standardizing care, and improving education. A few patient comments. Thank you for your professionalism and kindness before, during, and after my biopsy. So this was another one of our nurse-led initiatives, providing resources for our patients and families. And upon diagnosis, patients and their families have access to the support and guidance of our interprofessional team, urology, social work, radiation oncology, and nursing. And it certainly has been our experience that men prefer receiving written material that they can take home and review when they are ready to do so, and at their own pace. we have the patient information guide and personal record that's given to every patient newly diagnosed, a copy of Understanding Prostate Cancer by Sadden McCormick, and also a number of other related support resources within our area. And something new that we've started, a decision aid for men who have been diagnosed with an early stage prostate cancer. And actually, I brought a copy of the decision aid, and I'll be talking a little bit more about it, but it certainly is here for you to have a look at if you like. In our consult rooms, we keep copies of Our Voice, a publication of the Canadian Prostate Cancer Network, pamphlets from the Canadian Cancer Society, and also pamphlets from your support group here. In the waiting room, we keep copies of your monthly newsletter, The Walnut. It certainly helps to keep patients up to date with current research and what's going on. Prostate cancer support groups have certainly emerged as important community-based resources, such as yours here. Newly diagnosed patients are given contact for the PCCN Ottawa, and many of our patients have attended your meetings and mentoring sessions, and we've had nothing but positive feedback, how wonderful they have found it and helpful. And certainly nursing has developed a communication link with the PCCN for the exchange of resources and info, and that's through Harvey. Harvey and I have met for quite a few times at the Cancer Assessment Clinic and had an exchange of resources. Nurses and social workers have attended meetings here, and we've had opportunities where we've been able to speak. And it's estimated that 1,500 gay and bisexual men develop prostate cancer yearly, and though they share some similar concerns, gay men are likely to be affected differently by prostate cancer in terms of understanding their masculinity, sexuality, social relationships, and their relationships in the healthcare system. Here in Ottawa, we have a support group for gay men, Gay Buddies with Prostate Cancer, run by Bruce Bursey. And so it's a support group for gay men to talk to other gay men who have survived prostate cancer and learned to live with its challenges. So we try to provide information resources that specifically target the gay, bisexual, and transgendered population. And this is where I'm going to talk a bit about our decision aid, one of our more recent things that we have implemented. I'm sure many of you are aware that decision making can be an agonizing experience. Side effects and complications do vary across the treatment options, and many men are just unsure of what is best for them. But the importance of shared decision making is certainly clear where patients have a choice between different treatment modalities that offer similar survival outcomes, such as surgery versus radiotherapies. So the decision aid is given to those men who have an early stage prostate cancer. And members of the research team included nurses from research, from administration, and clinical practice, as well as information technology specialists and physicians who were also involved. Initial discussions started in 2007, and later on, focus groups and interviews were conducted to assess different quality tools. And there was agreement that decision aids would be beneficial. They needed to have simple language, visual appeal. They needed to help men consider values, be self-paced, and they needed to be able to share it with their family. So the end decision aid we chose was from Health Dialogue, and these are producers of videos and booklets that help men make important treatment decisions. Later, the research team developed a personal decision form. This is a 3-page patient questionnaire that gives us, the patients are given to fill out with the decision aid once they've had a chance to review it. And it gives us an idea of how informed they are, what they value, what matters most to them, and where they are in their decision-making process. We implemented this and implemented it in 2010, and the decision aid is given to the patient at the time of diagnosis. On the right is the decision aid, and it comes in the form of a DVD and a booklet with accompanying information. It provides information on all the treatment options, including associated benefits and harms. And in the DVD, it's men that have been diagnosed with prostate cancer, and they share how they came to their decision as to how they wanted to treat their prostate cancer. It certainly serves as an adjunct to physician counseling. The personal decision form on the left is that 3-page patient questionnaire that we ask patients to fill out once they've reviewed the decision aid. What we do is we enter the information, that their responses in the 3-page personal decision form into our database, and it creates a 1-page summary of their clinical information and their decision information. So this is just an overview of the process. Patients are referred to our unit. They undergo a biopsy, have a confirmed diagnosis of an early stage prostate cancer, and are given the decision aid to take home and review with their family and at their own pace. And then when they return, we take the information from their questionnaire, enter it into the database to get the summary sheet, and this is used to lead the discussion, further discussion between the patient and the physician. And at any time in this process, nursing is always available for further discussions and to provide further support and resources. And this is just what that 1-page summary looks like. So it's used to communicate patient preferences in the patient-physician encounter. And at the top of the form, you'll see its clinical information. And then in the next section, it gives us an idea of what the patient is preferring. And in this instance, this patient is preferring active surveillance. The next section underneath is knowledge questions, and this indicates that this patient is unsure that, or not aware that sexual problems can occur with both surgery and radiation treatment, so that would be addressed with further discussion. And then in the very bottom, that's the value section. That tells us what is most important to him, and this shows strong values favoring outcomes of active surveillance. But the patient has indicated that still needs a bit more support before he makes his final decision. Patients really liked the fact that they could review the DVD and booklet at home and at their own pace and with their family. Overall responses have been that they found it very informative and helpful. And decision aids do help patients make a decision. We're the first in Canada to use it for sustained use in a clinical setting, and nursing is certainly the critical link for getting the decision aid into the patient's hands. So we offer group education sessions for men that are undergoing a radical prostatectomy, the surgery, and certainly it provides support to patients that lets them know that they're not the only ones dealing with a prostate cancer diagnosis, and it also helps to promote discussion among patients. I remember one session where we had quite an animated discussion amongst all the patients about disclosure of their diagnosis, that particular topic. One of our younger urologists that has joined us, Dr. Bro, who you probably know him, he's come here to speak. He writes an order for all of his patients to attend the education session, so it certainly endorses the value of it. Some of the key topics that we discussed in the class are listed here, and it's extremely important that men and their families receive the education and information prior to their treatment about urinary and sexual difficulties, post-treatment, and even more importantly, what can be done about it. At each session, we ask patients and their family member to evaluate the teaching session, and we're always looking for comments to ways that we can improve the session. But this, again, was a snapshot in time, and it shows that 94% felt they got all the information they wanted, 100% felt it was informative, and then 89% that they were well prepared for their surgery. Overall, our accomplishments through an interprofessional team approach, and I can't stress that enough, it is definitely a team approach. We've decreased wait times, improved patient education, linked with resources, and been able to provide decision support. And again, some of the patient comments. One said, "Thank you for all your help during my cancer treatment. It made it much easier to deal with." Some of our future initiatives, there certainly has been some interest in the region in sharing our nursing practices with some of the regional community hospitals. And future plans also, we want to develop a self-directed prostate cancer learning tool for nurses across the region.